Hi, I'm Dr. Michael Bedecs. I'm a recovering conventional doctor is how I present myself. I specialize now in anti-aging, hormone replacement, and regenerative medicine. I'm also a patient of Dr. Sperling, and pleased to be so. I'd like to take some time today and share with you my experience and my sort of journey with prostate cancer, which includes my experience with Dr. Sperling in the clinic. So I was diagnosed with prostate cancer in 2014, and like most men who get diagnosed with this, it is startling. Not only is it startling in terms of life-changing, but it also now puts one in a position of, oh my God, what am I going to do about it? And if you do choose to do something about it, boy, there are a lot of choices out there. Hard to know what to do. And you may not feel like you have the best research tools at your disposal, but I do. I'm going to tell you what I did. So 2014, diagnosed with cancer. I saw several specialists, did my own research, and I came to Dr. Sperling. Why did I do that? Here's the story. I want to tell you about cancer. Cancer is an invasion. And like any good invading army, a good invading army needs two things before it actually invades. It needs to make sure it's got food supply and ammunition. Now in cancer, that means blood flow. So it's all about early detection of blood flow in the gland. And here's the story. The quicker that you detect it, the better it is for you if you decide to have it treated. Anyway, microvascularization, blood flow. And this is the amazing thing about the MRI. So they put an IV, they put some dye in your veins, and that dye goes right to the prostate and goes to the places where there's blood flow. Where you start seeing increase in blood flow in the gland, that's where something naughty is going on. The amazing thing about the MRI guided biopsy and treatment is by seeing these little areas of increase in vascularization, that's where you put the biopsy needle. That's where you take your samples, and afterwards, that's where you treat the cancer. Before this, the biopsy was done by blind biopsy. We knew you had a high PSA, and someone would go in. In fact, I will tell you, I recently had a friend who a month ago underwent the same thing. 26 biopsies. 26 biopsies. In my case, there were 3 areas of increased blood flow in my gland. Dr. Sperling went in and biopsied 3 spots. Yep, there were 3 places with cancer. A few weeks later, I came back into the MRI, and now he put a laser wire into the exact spot where the cancer was. Think about that. Completely discreet. And then he burned it out. Well, I had that done in New York, and Dr. Sperling was in New York at the time. I had it done in the morning. I flew home in the afternoon, woke up the next day, had sex with my wife, went kayaking, peed blood for a few days. That was it. Now, I think I had it pretty easy, because some men will actually require some, if you have more disease, sometimes there's swelling, may need a catheter. In my case, it didn't. It's been 6 years. Today, just had another MRI. And I'm clear of disease. PSA is low. And I've probably sent Dr. Sperling, I don't know, 15 or 20 patients in that amount of time, and everyone has been pleased with that. Not only pleased with the outcome, which is important, pleased with the fact that erectile dysfunction the chance of erectile dysfunction is very low. I'm going to tell you the truth. I made my decision on how to get this prostate cancer treated primarily on whether or not Mr. Happy was going to work again, because that's important to me. Incontinence, another thing that nobody wants to have building in their pants. So the wonderful thing about this practice is it's like a family here. Everybody from the techs to Vivian, Lillian, who's amazing. Everybody gets the same wonderful treatment here. Dan Sperling is a very thoughtful, wonderful guy. And I like him very much. I think I think not only is he an astute physician, but he's a caring person. And that's really important because this is a very hard time for a man to have prostate cancer. It changes your life. But I would suggest that if you are in the process of thinking about how to get treated, please look at all the alternatives. And you know what? You read about them, every one of them sounds wonderful. Every single wonderful. Every single one of them sounds wonderful. But I'm in the business of doing medical research on another level, and I will tell you this. If I had prostate cancer all over again today, knowing all the options that are out there, I would do it all over again right here at the Sperling Prostate Center. You have a great day.